Hi, my name is Luke, and I'm a first year school psychology student at Cal State Long Beach. And I will be talking to you guys today about services provided through an IEP or different types of accommodations we can provide students through an IEP. Like I said earlier, my name is Luke Arontovich, and I'm a first year school psychology student, part of an interdisciplinary training grant. And the other names you see down here, Liz and Myra, those are my partners in the project. So let's get started. All right, so kind of some objectives for our presentation is we are going to focus on understanding the services provided through an IEP, so OT, PT, SLP, and also diving into those acronyms because those can be confusing. Learn who supports your children. It's easier to get help when you know exactly the person who can get you that help and feel confident participating in IEP meetings. You, as the parent, know more about your child than we ever can, and so we really want to empower your voices to be heard in an IEP meeting and advocating for your child's needs. So let's just start off here. What is an IEP? An IEP, or an individualized education program, is a legal plan that provides specialized instruction, support services, and goals tailored to your child. So essentially, it is a legal document that has all the accommodations your child might need to access the curriculum and goals that should be tracked throughout the IEP, throughout how the school year. The goals should be tracked throughout the school year. It helps keep school psychologists, special educators, other educators accountable while implementing your IEP, your student's IEP with fidelity. So specialized academic instruction, or SAI, we might see this on an IEP. It's specialized teaching to meet learning needs. So this can look like many different things. Small group instruction, modified or scaffolded assignments. So teachers will divide the assignment into different parts and give instruction to the student so they can kind of have more explicit teaching. Extra support in core classes. So an IEP doesn't always need special education diagnosis. We can give supports to your student in general education. I kind of avoid the stigma. Organization systems, binders, notepads, laminated schedules, and zones of regulation. So many classrooms will have different posters or ways for students to kind of regulate their emotions, but in an IEP, there can be specific modifications for allowing a student time to regulate their emotion. And these are all different types of subcategories of accommodations we can give your children. Um, it can be as broad as they need extra time on test, or as narrow as they need to hold a special pencil when they write. We're here to support your students the best they need. And the special education teacher is in charge of providing this service. So our first service is speech language pathology. They support it's support for communication skills. So social communication skills, if a student is struggling socially and they need help kind of showing expressive or non-expressive or even nonverbal language, an SLP or speech language pathologist can help them. Improving pronunciation, for certain students that have a speech impairment like a lisp or a stutter, a speech language pathologist can help them to pronunciate their words and building vocabulary. So, especially in the intermediate grades, the SLP can work with students one-on-one or in groups to build vocabulary. And it's provided by a licensed speech language pathologist or a speech therapist. Okay, so OT and PT. The OT is occupational therapy or fine motor or daily skills. Another word for daily skills you might see in IEPs or special education jargony kind of um, websites or manuals is adaptive behavior. So adaptive behavior is like zipping up a zipper on your jacket, brushing your teeth, washing your face, using the restroom on your own, and occupational therapists can help with that, or even fine motor, holding a pencil, writing, typing. A physical therapist would work with more gross motor strength. So movement, like walking to school, making you walking to class, um, holding up your body weight in a chair. And a lot of the times, our students with disabilities may need these supports, but they're not explicitly offered in IEPs. So it's beneficial to know what is offered and what this looks like. OTs and PTs can be IEP can either offer them outside of school or some districts have them in-house. And some examples are using scissors, walking safely at school, manipulating fasteners, zippers, a lot of things that we don't think about that maybe can slip special educators' mind, and OT and PT can help build those skills. All right, so behavioral support or a BIP, it's the legal name is a behavioral intervention plan. This is another legal document similar to an IEP that outlines a student's behavior. Maybe it's a problem behavior like screaming in class or um, aggression towards other students. And instead of removing the student or taking them away from the curriculum, we as school psychologists and or behavior specialists will try to find a replacement behavior. Let's say, for example, a student is very aggressive when they don't get what they want. Next time, we can ask the student to just walk outside or regulate that way. And that's more positive behavior reinforcement. And these are a lot of plans. You might see this legal document in IEP, and it might not be explained on, but it's very similar to an IEP. There is goals and there's accountability to make sure special educators and school psychologists are following this plan. It's basically used just to support behavior of our students to make sure they are learning to regulate themselves and um, learn in class. Counseling, or a lot of the times we'll hear in IEPs is ERMS or ERMHS, which is an educational or a mental health assessment for students with disabilities. It's a type of support they can gain to if a disability is causing mental harm or mental health issues. So if a student has ASD or autism spectrum disorder and they are developing anxiety or depression because of this diagnoses, ERMS counseling can help them manage that. And some examples are coping skills. So just basic kind of teaching students how to cope with their thoughts or cope with their relationships, managing anxiety through different techniques like interpersonal therapy or cognitive behavioral therapy, and emotional regulation. For the schools that don't have emotional regulation programs, a lot of times ERMS counselors are the ones pushing this. And it can be done by a school psychologist, a therapist, or counselor. One really cool one thing to take into IEP meetings as parents is to understand what is at your child's school. If there is a school psychologist and they are in charge of counseling, maybe knowing their name and asking what it would look like in an IEP, or a therapist or a counselor, knowing those resources, which should be on the district website or your school's website, is very important to getting your child the help they need. And counseling is very similar to an IEP or a behavioral intervention plan. There are goals and there's different skills we're working on with your children. Some additional services that we don't think about but are obviously very important are transportation, so safe travel to school, either through an access bus or the district will figure out transportation for your child if you cannot take them or they cannot access the bus safely. Assisted technology, text to write or speech to write tools, note-taking tools, um, text to talk tools. There's a lot of assistive technology we can provide our students with disabilities so they can access the curriculum, and health and nurse services. So if a student comes in with prior developmental or medical needs, then a nurse can provide services or even a doctor with a doctor's note. So some of these examples are bus services, speech to text tools, and medication support. So for example, if a young student is needing to take insulin, then we can put it in their IEP that the nurse will help them administer their insulin so they're safe and they can focus in school. Lastly, one of the big things my group really wanted to preach is your voice matters. Our job as educators is to acknowledge that sometimes we don't always get it right, and sometimes we don't always there's some things we miss. You as parents know your children the absolute best, and we at Cal State Long Beach really want to work with parents and we want to work with the community that the parents reside in. And so ask questions, share concerns, and request services. It's not nagging, it's not being overbearing. You are entitled to know what your child is receiving and how they are receiving it. And it is our job to work with you as shared partners to reach a goal. All of our goals are to help your children. And by you supporting IEPs and using your voice, we can further help your child. So please, please, please voice your concerns. And that is all I have for you. Thank you. I will go back.